Welcome to Dr. A for Animals, the podcast that gives you reliable answers to your questions about animal health and wellness and useful tools to help you help animals, whether in your own home or out in the wild. Together with expert guests, I'll give you information that is based on scientific research and clinical experience. I'm Dr. Charla Ansorge, a small animal and exotics veterinarian, and I'm so happy to share my love of animals with you. Let's get started. Hey, thanks for joining me for episode 7 of Dr. A for Animals. I'm going to talk to you today about thyroid disease in dogs and cats. So in order to get that conversation started, we're going to go over some basics of the thyroid gland itself and what it does and why it's important. So the thyroid gland, it's a little bitty gland that's located right in the front of the neck, and that's in pretty much all mammals. So you have one too, and it's very important in a lot of different tissues in the body. So it regulates our basal metabolic rate, or our daily calorie expenditure. So just how many calories you burn when you're at rest. It helps to regulate body temperature, heart rate, blood pressure, gastrointestinal motility, skin condition, coat condition in animals, hair in people. So you can kind of think of the thyroid gland as the metabolic furnace. So the brain is the thermostat. It tells the furnace when to kick on or off. If it's not working hard enough or not producing enough hormone, the furnace doesn't make enough heat. If it's overactive, making too much hormone, things get way too hot. So we'll get into the details more later about a thyroid gland that is malfunctioning and what that looks like and what we can do about it. But first, we're going to get into more details about thyroid hormone production and how there's this interplay between a couple of glands in the brain and the thyroid gland itself. So that thyroid gland we talked about is a little gland in the neck. This is where thyroid hormone is synthesized. Now, the thyroid gland gets a signal to make thyroid hormone from the pituitary gland, which is a little teeny gland in the brain. So that's kind of a little control center that tells the thyroid gland via its own hormone, which is TSH, which you may have heard of on your own blood panels. That is thyroid stimulating hormone. So the pituitary gland releases TSH into the bloodstream. Thyroid gland picks that up and responds to that by making thyroid hormone. Now, the pituitary gland isn't acting alone either. It is snuggled right up next to another gland called the hypothalamus. That is the upper level regulator that produces another hormone called thyrotropin releasing hormone that tells the pituitary gland to release thyroid stimulating hormone that tells the thyroid gland to produce thyroid hormone. And then there's a wonderful negative feedback loop that's very common in biological systems, where those glands in the brain will pick up the thyroid hormone and be constantly kind of sampling the bloodstream to determine whether we need more or we don't need so much. And so they will then adjust their levels of their hormones to tell the thyroid gland, stop doing that or make some more. So that's how the thyroid hormone kind of fluctuates up and down throughout the day in every individual. And there are certainly things along the way that can go wrong. So now once the thyroid gland has received its message and it's producing hormones, it produces a large amount of T4, which is also called thyroxine, and a smaller amount of T3, or triiodothyronine. And that T3 is actually the active form of the hormone. So T4, in most cases, has to get converted to T3 by other tissues in the body, like the liver and the kidneys. So the T4 itself is not active, but that is the one that the thyroid hormone produces the most of. It does produce some T3 directly from the thyroid gland, but most of that is being made by conversion in other tissues. And then that T3 is the one that is taken up by other tissues in the body in order to make changes in what they're doing. So that the thyroid gland requires iodine. You may have noticed that the name of T3 is triiodothyronine. That is because it is made from iodine. So that is the primary tissue in the body that requires iodine to do anything. So iodine acts as an antioxidant and has some other kind of not very well understood roles in the body, but the primary role of iodine in mammal bodies is to make thyroid hormone. So this is important when it comes to treatment of thyroid disease when we talk about that later. So that negative feedback loop that I mentioned between the thyroid gland, the pituitary, the hypothalamus is really important for keeping things in balance and ensuring that the body has the right level of thyroid hormone to help manage all of those processes that I mentioned. So now that we have a kind of a basic overview of how the hormone works, we're going to talk about when things go wrong. So we can have hypothyroidism where we're not getting enough thyroid hormone production, or hyperthyroidism where we're getting too much hormone production. So always when you hear hypo and hyper, it can be hypoglycemia, hyperglycemia, that's low and high blood glucose, hypertension, hypotension, that's high and low blood pressure. The hypo is low, hyper is high, always the same. So in general, we get hypothyroidism in dogs and we get hyperthyroidism in cats, although there is a very rare congenital hypothyroidism in very young kittens that we can occasionally see. Thankfully, it is rare. So we're going to talk initially about hypothyroidism in dogs. People also get hypothyroidism. And it is somewhat similar, although there are different underlying causes in different types of hypothyroidism. In general, in dogs, this is caused by immune-mediated inflammation and destruction of thyroid tissue, and that makes it unable to produce enough thyroid hormone. So when that happens, we have that negative feedback loop where the hypothalamus and the pituitary are sensing, you're not making enough thyroid gland. That will lead to the pituitary gland releasing more TSH. But it doesn't matter because, unfortunately, that poor little thyroid gland is not healthy and it can't make enough hormone. So we'll have this usually high level of circulating TSH, thyroid stimulating hormone, but the thyroid gland will not be able to respond. And so the level of T4 and eventually the level of T3 will just not be high enough. And then we'll start having symptoms. Now, rarely there could be disease of the pituitary or the hypothalamus itself. And so in those cases, we might actually not have an elevated TSH because the problem is coming from the brain and not from the thyroid gland itself. So if, say, there's a pituitary tumor or there's some kind of head trauma that actually damaged those glands in the brain, we might see that. That's extremely rare in dogs. We see that probably more in humans, but an extremely rare cause for that in dogs. In most cases in dogs, it's immune-mediated disease of the thyroid gland itself. So we generally are going to see this in middle-aged and medium to large breed dogs. You certainly can see it in smaller breeds or occasionally in a younger dog, but that's not very common. We tend to be seeing it around kind of 4 to 6 years old. Golden retrievers, Dobermans, other kind of medium to large dogs. It's relatively common until we find this. And the most common signs that we see are weight gain despite a stable diet and no change in access to activity. Now, the dog may be less active because we tend to have a lower energy level when the thyroid hormone is low. So we can see a somewhat lethargic dog who's sleeping more, who may also have some exercise intolerance. So when they do try to go out and run around, they kind of get short of breath a little more easily. They're just kind of dumpy. We will often see some hair thinning or hair loss or just a dry or dull coat, flaky skin. Sometimes you may notice some cold intolerance, although that's a little bit harder to pick up on in a larger dog. Constipation potentially could be going on. And when the doctor does a physical exam on the dog, we might pick up a slower than average heart rate as another sign that this might be hypothyroidism. Now, every dog that's lazy and getting fatter is not necessarily suffering from hypothyroidism. So unfortunately, it's not an excuse for every dog. But when we have these kind of combination of signs, it's certainly something that we want to look at. And especially in a dog that hasn't had a diet change, but it has started having weight gain, it's definitely something to look at. So how we diagnose hypothyroidism is typically from a pretty run-of-the-mill blood test, although sometimes we need to dig a little bit deeper because of course, as with many laboratory tests, it's not a black and white test. If we get a super, super low T4, and this is a total T4 level on a blood test, we may be pretty confident in a dog that's also having compatible symptoms that they have hypothyroidism. But often we'll get this kind of, well, it's low, but it's not super low. And just to complicate matters, we can sometimes get what's called euthyroid sick syndrome, which is suppression of thyroid due to some other illness. So sometimes there's something else going on that is causing the thyroid hormone to look low on lab work, but that's not actually the cause of their lower activity and that sort of thing. So especially in an animal where we get a low thyroid hormone back on a blood panel, but they're losing weight, say, that they probably don't have hypothyroidism, even though we're seeing a low T4 on their blood work. So, and some breeds actually normally run lower. So if you have a totally healthy, crazy greyhound or sighthound, and they come back with a low T4 on their blood work, well, that's normal for that breed. They just run lower than the average. So we have to also keep that in mind when we're interpreting a low total T4. There are also a few medications that can falsely lower a T4. That's not very common, and dogs are not often on those drugs, but something to keep in mind. If your dog is on some medication, they come back with a low T4, can any of these maybe cause that if they're not having symptoms that are suggestive of thyroid disease? Now, we don't often run a TSH, but it is becoming a little bit more common, and especially in those cases where we think we have a dog with hypothyroidism, but their T4 came back kind of in the gray zone, or we got back a low T4 in a dog that we're not sure they really have hypothyroidism. They might, but it's really not clear. Then we certainly would run a canine TSH. It is different from a human TSH, so it is important to be running the canine TSH. We may also run a free T4, and what that means is the T4 that's circulating in the bloodstream that is unbound to other proteins. Total T4 includes the free T4 and the T4 that is bound to other proteins. Free T4 is the one that can get into cells and get converted to T3. So it's a little bit more helpful to look at the free T4 sometimes to tell us what's really going on in the body. In some cases, we may run a T3, but that one is the last one to get affected because it's the most important. The body is going to prioritize keeping that level steady. The T4 is our earlier indicator of thyroid disease. And in dogs, there may be an indication to run a thyroid antibody in cases that are a little bit more unclear because it is an autoimmune disorder in dogs. So a thyroid antibody, if that's high, that might help us to determine, okay, yes, this is really hypothyroidism. So there's this sort of gamut of tests. The total T4 is most commonly run, partly because it's inexpensive as part of a full blood panel. And we usually are not just going to run a T4 if we have a dog that's not acting quite right. We're going to run a full blood panel in most cases. And that adding on a total T4 is usually not very expensive. It's easy to do, and often that's the only one we need to run. So we'll usually start with that. And then if it comes back kind of equivocal, or we're really not sure, or it's something we didn't expect, then we're going to run a thyroid panel or maybe just a TSH to see if we can figure out the nuance and decide whether this is really hypothyroidism or not. Now, if we do have a dog that we've diagnosed hypothyroidism in, treatment is pretty easy. It's just a daily thyroid hormone replacement. Levothyroxine is the medication that's typically used. It's a synthetic thyroid hormone. And most dogs tolerate that very, very well and will, basically return to normal over the next month. So activity level generally will come up. They'll tend to lose some weight. Their coat will look better, and they just feel great. Now, it is a lifelong treatment. They will have to be supplemented with thyroid hormone forevermore, but their dose may change, and that is important to keep in mind, especially during the initial phase of treatment where we're correcting their sort of hypothyroid state and getting them to be euthyroid again, which is normal thyroid levels. So when they first start losing weight during treatment, sometimes their dose will need to be dropped a little bit because we can then end up a little bit too high with our thyroid hormone, and then we can end up with rapid heart rate, irregular rhythms, excessive weight loss, that sort of thing. So if the dose has gotten too high, we need to be really careful with that, because having a high thyroid level is a bit more dangerous than having a low thyroid level, because of those effects on the heart, and the blood pressure also can be quite high. So it is important to do follow-up lab work. We're typically going to do that about 4 to 6 weeks after we begin treatment, just to make sure that that thyroid hormone is in the right place, and to check the dog's weight, see how they're doing there. And then monitoring over the first few months is quite important. And then typically for most dogs, every 6 to 12 months, we're going to want to run lab work and make sure that everything is looking pretty normal. So prognosis with hypothyroidism is really excellent, as long as the dog is getting treatment. Like I said, they are going to need lifelong management with that thyroid supplement, but they're going to be totally normal with that. So, that's the nice thing about this disease, is it's very, very treatable. Most dogs return to completely normal within a few weeks of starting treatment, and most dogs are pretty easy to give a pill to if you put it in their favorite treat. Not every dog is the same, of course, and especially some of the smaller breed dogs, but most of our large breed dogs are pretty good at taking a little bitty pill inside of a treat. And it's not a yucky tasting pill, so most of them tolerate it quite well. So the opposite disease, hyperthyroidism, is very, very rare in dogs, and when it does occur, it's generally due to a malignant tumor of the thyroid gland. This is like less than 1% of cancers in dogs, so I'm not really going to talk about it, because this is something that's so super rare. But if you have a dog that's suddenly rapidly losing weight and they're maybe panting a lot and they've got a lump on their throat, definitely go to the vet, because yes, it could be a malignant tumor of the thyroid gland. But I honestly, I've never actually seen a case of this. But now, hyperthyroidism in cats is another story. So we see hyperthyroidism in older cats quite a bit. So this is where your thyroid gland has become overactive. So it's producing way too much T4 and T3. We probably will see a reduced TSH, because the pituitary and hypothalamus are seeing this very high hormone level in the bloodstream. But this overactive thyroid hormone just keeps on doing its thing. It's going to ignore the reduction in the thyroid stimulating hormone coming in, because the gland is abnormal. So in cats, this is most often caused by a benign tumor. So it's not a malignant, scary tumor, but it is abnormal cell growth that is actively secreting hormone. Now, it can also be caused by hyperplasia of the thyroid gland, and that just means that there's increased cell growth in the thyroid gland. We don't know why that happens. Sometimes it happens. And honestly, it's hard to tell, and we usually don't know. We're not usually diagnosing, oh gosh, does this cat have a benign tumor or just hyperplasia? Because it doesn't matter. It doesn't make any difference in the treatment or the prognosis. So in most cases, we don't know which one the cat has, but it doesn't really make any difference to the cat. So, and the underlying cause of either of these is, we just don't know. So this is a little different than in humans. Humans that have hyperthyroidism, it's most often an autoimmune disorder, although humans can get a benign thyroid tumor as well. Malignant tumors, which are generally a carcinoma of the thyroid cells, can occur in cats. It's maybe 1% to 3% of hyperthyroid cases in cats. So still quite rare. And typically we'll see a very enlarged thyroid gland. So commonly when we have a kitty with hyperthyroidism, we can feel a little bit of enlargement of the thyroid gland. But in the case of a malignant tumor, it often shows up as this really big enlarged gland or a mass that we can actually feel on the gland. So very, very rare, and treatment is going to be different, and we'll talk about that a bit. I do want to mention a myth that I have heard a couple of times from clients, that feeding fish or seafood diets may cause hyperthyroidism. That is not known to be a cause of hyperthyroidism. Those diets do tend to be high in iodine, which is, of course, the raw material for making thyroid hormone. But because of that negative feedback loop and those kind of checks and balances between the hypothalamus, the pituitary, and the thyroid gland, just having a higher input of iodine into your bloodstream or into your system doesn't mean you're going to make too much thyroid hormone. So you have to have an abnormal thyroid gland to have abnormal thyroid production. So it's not caused by the diet as far as any research has been able to show yet. So there's really no data that says And it has been looked into, and there's really no consensus saying that there's any risk to feeding primarily a fish-based diet to your kitties. So if your cat absolutely refuses to eat anything but seafoods, that's probably fine. If they do develop hyperthyroidism, it probably was not because of the diet. It's just that it's a pretty common disease of older cats. So we do mainly see it in older cats, usually over about 10 years old. I have rarely seen it in a little bit younger cat than that, but it's most common in cats over about 10. And the signs can be almost textbook in a lot of cats. It can be very dramatic. They tend to have quite a bit of weight loss over a relatively short period of time and still maintain a really good appetite and often a higher appetite. So often they're begging for food, demanding food, stealing food off your plate even. For a cat that's never done that before, that's suddenly like, give me all your food, and losing weight. But otherwise acting pretty normal, although I will say normal in quotes, because often these cats will start getting the zoomies. They'll be kind of hyperactive, kind of restless. And this is in an older cat that maybe has been slowing down a little, kind of more mellow. And then all of a sudden they're like, ah! like going nuts, eating a ton, and they just feel jittery. And that can be a really common combination of signs of a kitty that's got hyperthyroidism. The other, I would say, most common thing that I see is a real increase in vocalizing. So a lot of these cats are all of a sudden just wow, just really meowing, and they'll often be doing it at night. They're like walking around the house meowing. So because this happens in older cats, a lot of times people will come in thinking their cat has dementia, because they're doing this like pacing and they're running around and they're just acting kind of crazy. Every once in a while, they may even be acting a little bit aggressive. I don't see that very much, but that is documented in some of these kitties. Those are really common signs of a cat that has hyperthyroidism. Less commonly, we may see this kind of inverse where the cat's kind of lethargic and exercise intolerant. There's some debate these days about whether that actually happens, this kind of atypical hyperthyroidism. But I will say from personal experience, I've had hyperthyroidism. I have Hashimoto's, so I've gone back and forth between hypo and hyperthyroidism twice. And both times that I was hyper, I felt terrible. My heart was racing. I was out of breath. I could not exercise. I could barely walk from my car to work. And I would just sit there and pant for a few minutes because my heart rate was 130 when I was just sitting doing nothing. So I can understand there being that presentation in some cats. So I certainly think that it's within the realm of possibility, even though it's being sort of hotly debated right now. So other signs that we can see in a hyperthyroid kitty, vomiting is also relatively common, kind of intermittent vomiting. Occasionally we might see diarrhea and occasionally we might see constipation or kind of wobbling between the two. We may see a change in the coat quality. And when we get the kitty into the clinic and we're doing our physical exam, we will very often find a very rapid heart rate. Often we'll find a heart murmur because there's a bit of a physiologic change going on with the changes in blood pressure and heart rate that will cause a murmur. It most often is a benign murmur, and it often will resolve when we get the thyroid treated, but not always. Sometimes the elevated thyroid has been happening for long enough that it has actually caused some damage to the heart muscle. We will occasionally see breathlessness or open mouth breathing, often in thyroid kitties that have now been under the stress of getting in the car and coming to the vet. They'll be so stressed and their heart rate and respiratory rate have already been elevated that they will be open mouth breathing. And I know how that feels, panting from walking from the car into my office. So especially if they're stressed, they may start open mouth breathing. If you ever have a cat open mouth breathing at home, you need to come into the vet because that's not normal unless it's a crazy kitten who's just been playing super, super hard. These cats also often will have an elevated blood pressure that can be dangerously high. So in cats that have come into the vet and we're concerned about hyperthyroidism, we always want to check their blood pressure because often it's so high that we need to start treatment right now that day while we're waiting for labs to come back to tell us if this cat is hyperthyroid. So on to diagnosis. That is going to be done via blood work in most cases. And again, we're typically starting with that total T4, same as in dogs. And in a lot of cats, that total T4 is so high that it's a slam dunk diagnosis. And we also typically have those compatible symptoms that are pretty obvious in cats. So we have a high total T4 and a cat who's losing weight with a big appetite. We've got a cat with hyperthyroidism. Now, occasionally we'll have a cat with a little bit more subtle signs. They're having some weight loss. Their appetite's pretty good. They're an active cat. They're maybe only 10, 11 years old. Those kitties sometimes, we need to do some additional testing. Also, often in older kitties, maybe 14, 15-year-old kitties, will get just a slightly elevated total T4, and there's this very wide gray zone in older cats. So cats over about 12 years old, we expect their total T4 to be kind of gradually dropping. So we expect them to be kind of around 2 or under. And the older they get, the lower we expect their total T4 to be when it's normal. So for older cats, it should be lower. So if we get like a 15-year-old cat who's had a little bit of weight loss, but they're maybe kind of just acting relatively normal, and we get a T4 of like 3, well, that's a cat where we probably want to run a free T4 to give us a little bit more definition and tell us, is this actually elevated? We're starting to run TSH in cats now. Some people have been running the canine TSH in cats. It's not super accurate. It may be helpful in some cases, but the canine TSH is got about a 30% error rate. And to me, that's not that helpful. There is a feline TSH. It's not readily available yet. It does exist. Very few practices are able to get it because most of the commercial labs are not running it. So you have to get an in-house lab to run specifically that test. And because it's not really a part of our daily work yet, we're still kind of figuring out where feline TSH really fits into the big picture and how we can best utilize it. I'm thinking about adding it to my practice, but I want to know that it's going to be helpful and I'm not just wasting my clients' money by adding on this test. So I want to make sure that we know how helpful this test is and when it's really indicated to run it. But it's out there. It is something to maybe consider in these more nebulous cases because we definitely get them. This is relatively common in cats where we get kind of a gray zone. They don't all come in textbook. And sometimes we're finding this kind of moderately elevated total T4 on a routine blood panel in a senior cat. And that's why we run T4 on a routine blood panel in a senior cat, because sometimes we're picking up hyperthyroidism early before they've started showing really dramatic symptoms. And I wouldn't necessarily treat an older kitty that has a little bit of an increase in their T4 if their weight is stable and they're acting totally normal. So every individual is different, and some of them are just going to run a little bit higher. And I have seen some cats where their T4 is like 3 forever, and it never goes down like the typical older cat, but they never have any symptoms of hyperthyroidism. So maybe they are a teeny bit hyperthyroid, but if it's not gradually increasing over time and they're not having any symptoms, why would we treat that? If they're happy and healthy and maintaining their weight and eating a normal amount, I don't think that indicates any need for treatment of hyperthyroidism. Now, in some cases, especially in the case of a mass on the thyroid, we may need to do some imaging like a CT and some other testing in order to determine whether that's actually a malignant tumor. We can get thyroid nodules that are not malignant. We can get cysts on the thyroid. It's also pretty rare, but it is really important to work that up further and figure out if that's actually a malignant tumor, and that may require going to a specialist in order to get a CT scan and that sort of thing. Now, often in these cats, we also will see pretty significant liver enzyme elevations, and sometimes they can be quite dramatic. We'll often see a somewhat elevated red blood cell count, and we often will see a falsely decreased or normal kidney value in an older cat that actually may have chronic kidney disease. So the thyroid hormone being elevated will give a false decrease in the kidney values because it's increasing blood flow through the kidneys. So these are super important to be monitoring to make sure that these things resolve, and especially that kidney values aren't coming way up as we start to treat thyroid disease. I'll talk a little bit more about that when we talk about treatment. But like I mentioned, blood pressure check is also super important in these cats when they come into the clinic and they're getting their diagnostics done. So once we've confirmed that we have a cat with hyperthyroidism, we have multiple options for treatment. So the great news is this is a very treatable disease in cats. And it comes in very different versions of treatment. So there is an option for every cat, no matter how difficult the cat may be. So the first one I'm going to talk about is radioactive iodine or I-131 therapy, because this is typically a curative treatment. So what this involves is the cat will go in usually to a special facility, although there are some primary care practices that may offer this. Usually it's a special facility that's dedicated entirely to this treatment. Because they're using radioactive iodine, it does need to be managed very carefully. And the cat needs to stay in the facility for a few days while their radioactive waste is being monitored until it's down to an acceptable level for them to go home. So for most cats, that's 2 to 5 days. I would say on average 2 to 3 is what I've rarely ever seen a cat have to stay for 5 days. But it's possible. So for most kitties, 2 to 3 days, they're staying overnight in this facility. They receive an injection of radioactive iodine IV, and that radioactive iodine will then go be taken up by the thyroid gland. And the idea is we dose it in this very specific way in order to hit all of the abnormal tissue and basically kill it off, while leaving behind enough tissue that we have still some normal thyroid function. So what we want is a cat who can still make thyroid hormone. We don't want to fry the entire thyroid gland, but they're not making so much that they're sick. So, and in most cases that works, and it works great, and it's pretty amazing. Now, in a small number of kitties, we may need to do a second round of treatment. I think I've had one cat in all of my time as a vet who has actually needed to do a second round of treatment, and then everything was great. And then there's the occasional cat that gets a little too much and they end up hypothyroid. Now, that's not the end of the world, but it does mean you're going to have to give your kitty a thyroid supplement every day, just like a dog with hypothyroidism. So hopefully that kitty will take that tablet pretty easily, because they're going to need to have that lifelong. That's really rare. Again, I would say that happens a little bit more than the overtreating. I've had maybe 2 or 3 cats, though, in my entire career as a vet that have had to be on thyroid supplementation after radioactive iodine therapy. So in general, I would say this is an excellent option for most cats. The only downside is, that rare cat that really doesn't do well being hospitalized or being away from home. Most cats are going to tolerate it fine once they get there and they get settled in. These are usually facilities that are very comfortable and confident with cats. They know how to help kitties feel, content in their space. So in general, these cats do really well with the short hospitalization period. And they're not having a ton of stuff done to them. They get an IV catheter placed if they need a little bit of sedation in order to tolerate that. Most of these facilities are going to do that for them to make it a little bit less stressful. But a lot of cats, they don't need too much. They get that one injection, and then they're just kind of hanging out. Their poop and pee is being monitored so that we know when they're safe to send home. And then once you get them home, you are going to have to bag up their litter. They should not be going outdoors during the first few weeks so that you can bag up all of their waste, and you have to store that for, I think it's 90 days, so that radioactive iodine is breaking down, and then you can toss it. So a couple of weird things that you have to be ready for. Now, I have had a few clients that are really nervous about having their cat be radioactive when they come home. In general, the facilities will tell you to kind of reduce contact for the first week or two, to try not to sleep with the cat, wash your hands frequently, just in case there's a little bit of that radioactive iodine that's getting on their surface, but that your risk of actually getting any of that radioactive waste into your system is super, super low. And I don't think that I haven't seen any documented cases of any kind of adverse effects on people. People with hyperthyroidism are often treated with radioactive iodine as well. If you were being treated with it, you would be receiving a much higher dose. But the little bit that you might get exposed to from your cat getting treated, I have never seen any cases of a person actually having any thyroid dysfunction because of that. If you're really super nervous about it, then you might want to board your kitty somewhere for a week or two, or just, keep them in a bedroom and have minimal contact. I wouldn't be able to do it because my kitties are too cute. But in general, it's a very safe treatment. We don't tend to see complications aside from that, potential over or under treatment, which, like I said, is quite rare. And then you have a cat that's probably cured and doesn't need any further treatment. They are going to need follow-up monitoring, and that is super important. So typically 1 month and 3 months after treatment, we will recheck their lab work. We want to know how their kidneys are doing, because once we get that thyroid under control, we often will start to see kidney values increase. So many of these cats that have hyperthyroidism, because they are older cats, they also have chronic kidney disease. And that may not have been diagnosed yet, but it often will be unmasked once we get the thyroid hormone down to a more normal level. So that's very important to be monitoring pretty closely those first couple of months after treatment. We're also going to want to be monitoring blood pressure, make sure that that's staying normal. And in a cat that has had very severe hypertension and has been on additional medication for the blood pressure, we may be able to wean that down and discontinue it once they're treated if the hyperthyroid was the only cause of the high blood pressure. I've had the occasional cat that still has high blood pressure even after they're treated, and they do need to stay on medication for that. But in the vast majority of cases, I would say when we have a hyperthyroid cat come in with hypertension as well, they often will normalize once the thyroid hormone has normalized. So, and then that's it for those kitties. We certainly would want to keep an eye on thyroid throughout their lives with their regular lab work, and we would be running that total T4 as part of just regular, senior lab work. But those cats that got I-131 therapy, usually, once they've stabilized in the first few months, they tend to not need anything else as far as their thyroid. So the other option, and a lot of people will choose this because of the one major downside of the radioactive iodine therapy is it does cost, depending on where you live, probably $1,500 to $2,000 these days in 2025. And in some areas that are, kind of generally more expensive, it's probably more than that. But most of the facilities I know of are still kind of in the $1,500 to $2,000 range. So if that immediate cash outlay is just not an option for you, or if you have like an 18-year-old cat that just got diagnosed and they're 18, they're kind of getting towards the high end of lifespan. Some people opt not to put out that cost or to hospitalize them because those kitties can be more frail. People are more worried about them. So if you don't want to go that route, there is another option, which is wonderful. And it is a medication called methimazole, which is also the drug that I've been on to treat my hyperthyroidism. And most cats tolerate methimazole quite well, but there are some adverse effects that we need to watch for. And it comes in several different forms, and this is one of the rare and wonderful medications that actually can be absorbed through the skin quite well. So in cats that are really difficult to give oral medication to, we do have the option of making it into a transdermal gel that you rub on the inside of the ear flap where they have naked skin. And it's absorbed through the skin quite well. And typically we're using the same dose that we would use orally. And most cats will have just as good a response to that as they will to the oral medication. Now, the adverse effect that I have seen from the topical medication or transdermal medication is some cats do have a skin reaction to it. Now when that happens, sometimes we can get a different formulation made that they don't react to. So it's always worth trying a different compounding pharmacy. But that's something to be watching for definitely if you opt to go with a transdermal medication for a kitty. Now, methimazole does also come in tablets, and there's a new flavored liquid out there for cats that do better with liquid medication. And for cats that will take, a pill pocket or a pill assist treat wrapped around the tablet and will take the tablet pretty well, it might be super easy to do the oral medication. adverse effects are possible, and a fair number of cats do have tummy upset with methimazole. And in those cats, often what I'll do is drop down their dose for a couple of weeks, give them a couple days of an anti-nausea medication, and then gradually increase the dose. And for a lot of them, that gradual adjustment just clears up the tummy upset, and then they end up doing fine. Not every kitty. If they're really sensitive to it and they're having vomiting, well, that medication is not going to work for them. There's the rare cat that will do better with the transdermal version, so that's worth trying in a cat that's having GI upset with oral methimazole. But some of them will have it regardless because they're having it because of the medication being in their system and not just being in their stomach. So it depends on the cat, but it's worth kind of trying a couple of different versions to see what they tolerate best. So I would say that's the most common adverse effect from methimazole. And that's probably about 20 to 30% of cats will show those symptoms, at least initially. And then some of them, like I said, that it will clear up and they'll get used to the medication and be fine. There are other issues that we can see. They are quite rare, but they are certainly possible. One of them is effects on the liver. And we can see when we do our follow-up lab work, that massively high liver enzymes. And those cats cannot be on methimazole. We need to stop the medication right away and start them on another treatment, ideally radioactive iodine. There is the occasional cat that may also have damage to blood cells, and it can be red blood cells or white blood cells or both. So we may see a massive drop in either or both lines of blood cells. And that also is not good. We need to stop the medication right away. Probably not going to be able to use that medication in that cat. Now, these things should clear up when we discontinue the medication. So on the bright side, these do not tend to be permanent damage situations, which is good. So it's always worth trying the methimazole. Even if we have a cat who does have an adverse reaction, they usually will be fine once we take them off the medication. They may need a couple of weeks of recovery time. But in the one cat that I've ever seen with the massive liver enzymes after starting the medication, he actually wasn't even having any symptoms. We just found it on his lab work, and he wasn't even sick. So that's a good thing. Now, the other problem that we can see with methimazole, and this is why I tend to not recommend it in younger cats that have been diagnosed, they can become refractory to the treatment over time. So that benign tumor that's secreting hormone can continue to grow and become more and more difficult to manage. So in some of these cats, after they've been on methimazole for 2 or 3 years, we start having to increase the dose. And we get to a point where we can't give them a higher dose. So if we have this kind of refractory hyperthyroidism where the hormone keeps getting higher and higher and they're not responding to methimazole anymore, then again, we're going to have to turn to radioactive iodine therapy, most likely. So that's something to keep in mind. If you do have a younger cat, I would highly encourage you to seek out the radioactive iodine therapy to treat hyperthyroidism rather than putting them on the medication, because eventually, at some point, you're probably going to have to do it anyway. But it's totally okay to start with methimazole and switch to radioactive iodine therapy. There's no problem with that at all. The only thing that you're going to have to do is stop the methimazole, usually about a week before radioactive iodine therapy. So if you're not sure, you're on the fence, or you need some time to save up money, you can start them on methimazole and a year later go get the radioactive iodine therapy. That's totally fine to do. Other treatment options do exist, but they're not as good. So our old treatment for hyperthyroidism was surgery, to surgically remove the abnormal thyroid tissue. There are lots of potential complications with that, and so that is not used really anymore to treat hyperthyroidism, except in the case of a malignant tumor. So if there's a malignant tumor, we often can actually treat that with radioactive iodine therapy. But in some cases with a very aggressive or a very large tumor, we are going to have to treat with surgery. And that I highly recommend be done by a board-certified surgeon. And then finally, there's dietary management. So there is a prescription diet out there that is an iodine-restricted food. And so the idea is by restricting access to iodine, the thyroid gland will not be able to make thyroid hormone. So some cats seem to do well with this diet. I'll be honest, it's not my favorite, even though I am perfectly happy with the company that makes the diet, and they make a lot of great prescription diets. This one's not my favorite. There are some concerns about its efficacy, and partly one of the things that has been shown is that we don't see the improvement in the elevated liver enzymes that thyroid disease can cause. Now, this is different from the elevated liver enzymes that, in rare cases, methimazole might cause. Hyperthyroidism itself very often causes elevated liver enzymes, and those usually improve like by the time we're doing our next set of follow-up lab work. But in cats that are on the iodine restricted diet, we often will not see those levels improve. We also often will not see changes in the kidney values, so that it's a little confusing as to what's actually going on in the body. So there's some concern about whether it's really honestly treating the disease. And one of my major concerns is sustainability of the diet. So if you're managing thyroid disease with an iodine restricted diet, you cannot feed anything but that one diet forevermore. So you cannot give any treats. You can't give tuna juice. You can't give anything else to your kitty besides that one diet. And cats tend not to do great on one diet all the time. There are some exceptions. There are some cats that are so picky they will only eat one thing, but most cats want some variety in their diet. So it can be very tricky to maintain the feeding of just this one diet forever and ever. And that is how you have to do it if you're going to manage thyroid disease with a diet. I will sometimes use this diet in cases where, we have a sick kitty that's not doing well with methimazole, but we can't get them in for radioactive iodine for several months or something like that, where we know we're going to be using it for a few months, but probably not forever. So I will use that diet in certain cases as kind of a temporary fix, or, in the case with an animal that's had a bad reaction to methimazole and we need to just get them better right away, and we don't want the thyroid hormone to start shooting up really quickly. It can be helpful, but as far as a primary treatment for hyperthyroidism, it does have some issues. But it's something to be aware of. It is an option. It's not my personal favorite, but it is out there. So with any version of treatment of hyperthyroidism, follow-up monitoring is super important. So, we want to look out for adverse effects of drugs. We want to look out for unmasking of chronic kidney disease. We need to check and see if we've got the thyroid hormone at the right level, because not every cat is going to need the same dose of whichever treatment that they've gotten. So we're typically checking lab work after 1 month, regardless of the type of treatment. And then it might be every 3 to 6 months, depending on how they're doing. And then for most cats, if they're on methimazole, I prefer to check them every 6 months long term. If they've gotten radioactive iodine and they're otherwise super healthy, it might be annually, but most of these cats are seniors and probably should be getting lab work about every 6 months anyway, because they're senior cats and things can change relatively rapidly. And then, of course, we want to monitor blood pressure and all that kind of stuff. So the prognosis for cats with hyperthyroidism, well, if we don't treat it, it will be fatal. So it absolutely must be treated. It will cause heart failure. It can, secondary effects from hypertension, sudden blindness, stroke, kidney failure, seizure, coma, all of these things can happen with untreated hyperthyroidism. They will die from it if we don't treat it. So treat it. The prognosis is quite good with treatment. So as long as we don't have problems with methimazole and for some reason can't do radioactive iodine. There are some cats that are not a good candidate for radioactive iodine therapy because they've got some comorbidities or something like that. But most cats have a very good prognosis as long as they're on treatment for the hyperthyroidism, and usually will live many years with their disease being well managed. But of course, we do have to be monitoring. These are senior cats. We do have to be monitoring them, especially for things like chronic kidney disease, and we do have to be managing those comorbidities. We can't focus on just the thyroid disease and not pay attention to everything else that might be going on with this elder kitty. Now, we don't see acquired hypothyroidism in cats, which is interesting, but we just don't see it. We do see it, though, sometimes in kittens. This is extremely rare, but this can actually be a defect in the development of the thyroid gland in very young kittens. So they're born with it. And it is unfortunately life-threatening in young kittens. So it can be variable in how severe it is, but in some very young kittens, it is probably one of the reasons for so-called fading kitten syndrome or sudden death in very young kittens, because it will cause problems in the function and development, primarily of the cardiovascular system is the thing that we're concerned about acutely. So symptoms can show up quite early. It can be in the first few weeks of life, and it can be a kitten that just fails to thrive. If they manage to get past that phase, because in a kitten that young, it can be nearly impossible to diagnose this. There are so many reasons for fading kitten syndrome, and so many of them are just so difficult to be able to even get the diagnostics on such a tiny little kitten that we don't even have a chance to diagnose it. But if they manage to get through that period, what we'll see is typically stunted growth, and as they do start to progress a little bit, we'll see kind of short limbs. They'll be kind of these little cobby kittens. They often will have a broader face than a typical kitten. So they look a little bit off. They often will present with constipation, and oftentimes that's the reason they're showing up at the vet, is they're constipated. And it will happen, like we'll treat the constipation, and then a couple days later they're constipated again. A lot of these kittens are like really cuddly because they're tired. They don't have a lot of energy. They're kind of sleeping more, and they're not very playful. So if you have a kitten who looks kind of a little like short-limbed and stumpy, and they're just like really cuddly and sweet, but they're not very playful, that's not normal. So kittens should be little spitfires and like full of energy and running around playing by the time, about 3 to 4 weeks old when they start playing. Once they figure out play, like they want to do that all the time. So kittens should be running around playing, eating a lot of food, and then sleeping, and then running around playing, eating, and sleeping. And they may have periods when they're cuddly and just, want to snuggle, but they should be quite playful for a lot of the time that they're awake. And if they're not, that's a signal that probably something is a little off. Kittens with hypothyroidism often will also have abnormal bone and ligament development, so they often will show up lame, and they can actually be painful. They can have poor mobility and not be able to navigate well. They might seem a little like off balance almost, not like a kitten with a brain lesion, not to that level, but they might just not be able to jump well and that sort of thing. They can be downright lethargic, weak, mentally dull. They usually will have delayed tooth eruptions. So if we're getting into, a 7-8 week old kitten, we'll often see like they don't have any teeth yet, or they've just got a few little incisors, and the rest of their teeth haven't even started coming in, and they should be at that age. These cats will often have a kind of a funky hair coat, or kind of poor fur quality. And then when we get them in for a physical exam, they usually will have a lower than normal body temperature as well. This is super rare in kittens, and it's often unrecognized by doctors, unfortunately. I have only seen it in a couple of kittens. I had a kitten come in last year that had been seen already by 2 other vets for constipation. And the owner had noticed she thought the cat looked like a dwarf. And she mentioned that, and one of the vets actually noted might be pituitary dwarf in the medical record, but didn't talk to the owner about it. And let me tell you, pituitary dwarfism is a much more serious disease even than hypothyroidism. And hypothyroidism can be fatal. It will be fatal if it's not treated in a kitten. So if the kitten was a pituitary dwarf, like that needed to be a big major conversation. So it's kind of like, wow, we just sent this kitten home with an enema, and not great. So this little kitten was super cuddly, little round, short ball of kitten. And when I asked about his activity level, the young lady said he was not a very playful kitten. And so we tested his thyroid, and luckily he was a big enough kitten that we could get a decent sample and test this. And sure enough, he was a hypothyroid kitten. So once he got started on treatment, he turned into a normal, normal rambunctious kitten. This kitten also was definitely painful in the hips and knees. He did not like me trying to do an orthopedic exam. He was unable to jump more than a couple inches. He was a pretty textbook for a very rare condition. Luckily, I had seen a hypothyroid kitten when I was a vet student, so I knew what to look for. But this often is not recognized because it is just so rare. And I've even met vets who didn't know that it existed. So if you got a little young kitten who's not thriving and has some of these kind of signs, keep it in mind. You might need to ping your vet for maybe we should test his thyroid hormone. So, luckily this is certainly treatable, and we treat it the same way we treat dogs with hypothyroidism or hyperthyroid cats who have gotten a little too much radioactive iodine. We treat with levothyroxine. So you're going to be giving them a tablet every day for the rest of their lives, but we usually will see pretty dramatic improvement in their quality of life within a couple of weeks of starting supplementation. Now, the later this gets diagnosed, if we have a kitten who has managed to get very far in development, they may have permanent changes. So they may not ever completely develop normally. Their growth may be stunted and they may be kind of a small, short-limbed kitty forever. But in general, their comfort will improve. They may not have normal mobility. They may not be able to jump high and that sort of thing, but they'll probably be comfortable and in general, able to run around and play. In kittens where we catch it pretty early, they have a good chance of actually developing pretty normally and having a totally normal long life. So definitely something that we want to keep in mind for kind of these rare situations where we have a kitten who's just not thriving well. So definitely, if you do have a kitten who seems off, or they seem like they're not growing, or they're not very active, that's always a warning sign in a kitten. Kittens should be super active when they're awake, and not sleeping, 5 times as much as the other kittens in the group. So if you're noticing that they're not very active, or they seem a little bit off, or they're kind of shorter than the other kittens, or their teeth haven't erupted, you definitely want to get to the vet soon. So that is the long and short, the hyper and the hypo of thyroidism in dogs and cats. So, that the thyroid is a very logical gland. So once we understand how the thyroid hormone affects metabolism, it makes a lot of sense, the kind of symptoms that we'll see. So you can understand where having a low thyroid will kind of shut down the furnace and sort of turn everything slow and dumpy, whereas having high thyroid kind of makes everything too hot, too fast, all that kind of stuff. So it all makes a lot of sense. If you are seeing signs that you think are suggestive of a thyroid problem in one of your animals, the earlier we detect it, the easier and safer it is to manage it, and the more impact we can have sooner on that animal's quality of life. So especially with your senior pets, regular checkups and lab work are super important. So definitely get them into the vet on a regular basis. I know I proselytize about that, but I can't tell you enough how important regular health checks are. But definitely if you're seeing any of those symptoms that you think are suggestive, and especially in a senior cat, because that's, or a kitten. In cats, the disease is just more life-threatening than it is in dogs, so it's more urgent. But certainly it's a huge impact on quality of life for all groups. So one more thing I want to say is there are some supplements out there that claim to boost thyroid function or normalize thyroid function. Don't go for that. So don't try to diagnose it yourself, and don't go for these supplements out there because they have zero data to back up anything that they're claiming, and they are not a treatment for thyroid disease. So if we do have thyroid disease, we need to diagnose it and we need to treat it appropriately. So definitely don't be taken in by some claims out there from companies that hopefully mean well but aren't actually accomplishing that. Worst case, they're just kind of marketing something they want to make money off of. But there's no supplement out there that's going to fix thyroid disease. So if we really do have thyroid disease, we need to treat it appropriately. And if we don't have thyroid disease, there's not a supplement out there that's going to make your thyroid better. Just eating an appropriate diet and having an appropriate, influx of iodine on a regular basis so that we have the building blocks to make thyroid hormone. That's what we need. So good levels of protein in the diet and iodine in the diet are what we need to make thyroid hormone. So I hope that has been enlightening and interesting. And I appreciate you listening. I hope that you will subscribe to the podcast. And I hope that you will go and give your beautiful little animals hugs for me. All right. Thanks, guys. See you next time. I hope you enjoyed this episode of Dr. A for Animals. This podcast is for educational purposes and does not substitute for specific medical advice for an individual animal or constitute the practice of veterinary medicine. No veterinary client-patient relationship is formed through listening to the podcast. If you have an animal in need of medical care, please see their veterinarian.